Hello everyone, I'm start. Am I audible and visible? Am I audible? Okay, fine. Hello everyone, welcome to Unacademy Future Doctors. I'm myself Dr. Dipti. I'm MD, PhD Physiology. I'm associate professor and educating MBBS, physiotherapy, nursing, dental and MD students, and I have more than 17 years of teaching experience. Now, let me explain in brief about our subscription. We have two kinds of subscriptions. Number one, that is plus subscription, in which you can choose the best from the best. Here, you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access QuestionBank, which is having more than 25,000 questions. You can compete in the live test and quizzes. And with 12 months and above subscription, you can get printed notes too. Second is our iconic subscription. Here, your access to the best from two of the best. And they are, one is Unacademy and Prep Ladder with Unacademy. All the features we have explained. And second, that is Unacademy and Prep Ladder with Prep Ladder. Here, you can have clinical and integrated essentials, video lectures from the Dream Team, QuestionBank 3 with active guidance, system tags, and much more. Rapid revision and snapshots and treasures in 2021 Dream Notes. Also, we have added certain features in our special class. We made the class interactive. You have a facility of raise a hand. You can talk to your educators in the live class. You can poll for the learners. You can never miss a class as you get notified for your class always. You can get PDF notes, lecture notes, and you can access your class anywhere and at any time. Also, we have updated and highly effective question bank, which is having more than 25,000 high-yield clinical questions, which are based on latest exam pattern, and it also includes detailed explanation too. These are our NEET PG 2021 toppers. We also have started our Focus FMG 2022 comprehensive batch from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch from 15 December, that is for 3 months. Also, there is a big surprise that awaits you, that is a NEET PG Compact. And here, this time, we hope you get lucky. Here, 50 participants, they will be rewarded with Amazon gift vouchers. Note down the date is 23rd January at 11 a.m. NEET PG Mega Combat. You can get a chance to win prizes, that is more than 10 lakhs. Okay, top rankers, they get chance to win 100% scholarship. The test is for 60 minutes and it is having 45 questions. Okay, the dates, as I told you, 23rd January at 11 a.m. You can enroll now. Enrollment is free. This is here the same thing. Reward from a pool of rupees 10 lakhs plus 100% scholarship for rank 1, 75% for rank 2 to 10, 11 to 50 gets 50% scholarship, and 51 to 200 gets 25% scholarship. Okay? Now, let us come. Next is you can subscribe any of the subscription from your mobile, either Plus or Iconic. You can use my code DIPTI10 and get 10% extra discount. Now, let us come to the topic. Today's topic, that is characteristic of skeletal muscle in intact body. Learning objective for today's topic, that is muscle tone, we will discuss. We'll also discuss nature of muscle contractions, gradation of muscular activity. We'll also discuss muscle fatigue, mechanics of muscle. Also, we will discuss in today's class. Starting with first one, muscle tone. What is muscle tone? How will you define muscle tone? Muscle tone is a state of partial tension. So tone is defined as a state of partial tension present in the muscle. All the skeletal muscles, they have tone. More tone is there in our anti-gravity muscles. Anti-gravity means the muscles, they have to work against gravity. Okay, they have more tone. Okay, now how the tone is maintained. Okay, this maintenance of tone, let me just change the color here. Tone maintenance, that is because of, you can see here, gamma motor neuronal discharge. You can see here this gamma motor neurons, they discharge, and because of gamma motor neuronal discharge, you can see here there is stretching of the muscle, and because of stretching of the muscles, impulses are transmitted through sensory fibers, and this sensory information, you can see here this sensory 1A fibers, they have been given to the spinal cord, and efferent fibers, they come through alpha motor neurons. So this alpha and gamma activity, so this is known as alpha gamma co-activation. Okay, this is important for the maintenance of muscle tone, and this gamma activity is regulated also by higher centers, upper motor neurons too. Okay, here. So this way muscle tone is maintained. Okay, now next is abnormalities in the muscle tone. Abnormalities are either there is increase in the tone or decrease in the tone. So hypertonia or hypotonia. Okay, this one. Hypertonia is also known as spastic paralysis. Hyper or tone increases, increased tone. Okay. Now, what is the reason for hypertonia? Why there is hypertonia? Commonly it is seen, hypertonia is seen in upper motor neuronal lesion. Just a minute. Neuronal lesion. Why? In upper motor neuronal lesion, because upper motor neurons, they regulate the lower one. So when upper motor neurons are damaged, you can see lower motor neurons are not regulated. So that is increase lower motor neuronal discharge, and that is responsible for increase in the tone, which is known as spastic paralysis. Here one important thing is there are two words. One is spasticity and second is rigidity. What is the difference? Spasticity means increased tone in one group of muscles. Okay, single muscle group tone increases, whereas in rigidity, you can see this is rigidity, both the groups of muscle tone increases. Okay, like flexors and extensions. Suppose both tone increases, then what happens? Limb becomes rigid. Okay, so this is hypertonia. Next is hypotonia. Hypotonia is commonly seen in the lower motor neuronal lesion. You can see here. This is our lower motor neuron. When lesion is here in the lower motor neuron, because this lower motor neurons are important for maintenance of muscle tone. But if these are damaged, then what happens? Tone is lost. And when the tone decreases, that is known as flaccid paralysis. Okay, so in upper motor neuronal lesion, we have spastic paralysis. In lower motor neuronal lesion, we have flaccid paralysis. Okay. Now, next small thing we will discuss, that is nature of voluntary contractions. Voluntary contractions, they are tetanic in nature when the contraction is strong. Okay? Suppose you can see, when I ask you to hold something for a long period of time, what happens? You just have to continuously contract your hand or the limb. So tetany, what do you mean by tetany? It is a state of sustained contraction without relaxation. Okay, sustained contraction. Okay, here. So this tetanic contractions are there when the this contraction is strong, but if the contraction is weak, then there is relaxation in between. So that is known as subtetanic. Okay. Now another important thing here is when one group of muscle fibers they are contracting, other group may be relaxing. So you can say firing of one group of muscle fibers at the same time other muscle fibers are silent. So when the firing rate increases and when more and more motor units are recruited, you can see here when only one, this is one motor unit, it is active, then only 5 muscle fibers are stimulated. When the second, 10. Okay, so more and more motor units are recruited, then they become powerful contractions. The contractions are powerful. Okay. Okay. Now, next is various factors. They affect gradation of muscle contraction in intact body. Which are the factors? There are 5 factors. Number 1 is our motor units. Second, frequency, number of impulses. Third, synchronization of nerve fibers, impulses. And fourth one, initial length of muscle fiber and effect of warm up. I'll discuss one by one. First is recruitment of motor units. When motor units, you can see, suppose as I told you, this one motor unit is recruited, this one. What happens? Your 3 muscle fibers are stimulated. Okay. So when one motor unit is active, Ayushi, hello, welcome to my class. Namaste, beta. So one motor unit is recruited. You can see one motor unit is recruited. 3 muscle fibers are stimulated. When this blue one is active, again 2. So when both are active, what happens? 5 motor units are recruited. So what happens when the strength of contraction increases? Suppose if I tell you to just raise some small book, then what does it require? It requires less strength. So less muscle fibers recruitment. But if I ask you to pick up or to raise this heavy load, so what happens? You require to produce strong contraction. And when strong contraction is required, you can say that more motor units are recruited. So more the motor units recruited, more and more will be the muscle contraction. And this is known as multiple motor unit summation. The activity is summated. Okay. Motor unit summation. Okay. So this is the role of recruitment of motor unit. Third thing, this frequency of nerve impulse. You can see here. This is one motor unit which supplies 5 fibers. You can see here. Second supplies 7. Okay. So when frequency is 1, then 5 are stimulated. When 2 nerve fibers are stimulated, then 5 plus 7, 12. So increase discharge. Okay. Increase frequency, that results in summation, and this summation is known as wave summation. Okay. Previous one is multiple motor unit summation. This is wave summation. This also affects muscle contraction. Third is synchronization of nerve impulse. What is the synchronization, Joe? For example, suppose if I am doing contraction. Okay? So what happens if I am doing flexion? So my flexion muscles are stimulated but extensions are inhibited. So you can say that this motor units, red one are inhibited here, inhibition, and this green one are stimulated. But this activity must be synchronized. Then only the movement becomes smooth. For example, suppose if I would like to do flexion, but my extensions are not inhibited, what happens? I cannot perform flexion. So this nerve impulses, they are synchronized in such a way that when we require particular action and we require to stimulate one group of nerve fibers, other must be inhibited. Okay, so synchronization. Then next we have already discussed effect of initial length of muscle fiber. If all of you are knowing Frank-Starling's law, I discussed with you that what is Frank-Starling's law? Can anyone? Within physiological limits, we have already discussed so many times. Within physiological limits, Frank-Starling's law is very important. Within physiological limits, force of contraction is directly proportionate to initial length of muscle fiber. I gave you the example also. आपके पास रबर बैंड है, उसको स्ट्रेच कर रहे हो, स्ट्रेच करोगे, ज्यादा स्ट्रेच करोगे तो इनिशियल लेंथ बढ़ जाएगी. इनिशियल लेंथ मीन्स बिफोर मसल स्टार्ट्स इट्स कंट्रैक्शन. सो लेंथ इंक्रीजेस, फिर स्ट्रेच करके छोड़ रहे हो तो force of contraction also increases. Okay, and this is within physiological limit. Very important thing. Why? Because physiological limit से ज़्यादा stretch कर रहे हो तो it will be broken. So this also affects muscle contraction, one of the important factor affecting muscle contraction. And I discussed what is the effect of warm up. Athletes, they always do warm up. You can see here, this fellow, she wants to run. So this quadriceps and hamstrings and all muscle contraction is required. And to make the muscle contraction forcefully, she must do warm up. Warm up, by doing warm up, what athletes they do? They stretch the muscle. Stretching increases initial length. And more the initial length, more will be the force of contraction. So this way one can improve the performance. Okay, so by increasing, by that depends on Frank-Starling's law. One of the important question may be asked as a short question in your physiology exams. Okay, another important thing here is Frank-Starling's law, वो भी मैंने बताया था. It is followed by which muscles? Which muscles they follow Frank-Starling's law? If anyone knowing Frank-Starling's law, followed by which muscles? If you know the answer, please write down in the chat box. Followed by our, can anyone please? Skeletal muscles and cardiac muscles. Very important thing also here. How? Skeletal muscle, we have seen effect of stretching. Cardiac muscle, in cardiac muscle, suppose this is your heart. Heart is getting more venous return. Okay, venous return means blood coming to the heart through veins. More venous return, more will be the stretching of heart muscle. More will be the stretching, more is your initial length, and more will be the force of contraction. This is Frank-Starling's law. Very important thing again here is physiological limits. Okay, why physiological limits? Because if there is heart failure and heart is having large amount of blood, more the stretching is there, but it is above physiological limits, so heart cannot pump more. Okay, so that is the effect of initial length of muscle fiber, that is Frank-Starling's law. Okay, now next important topic we are going to discuss, that is muscle fatigue. One of the property of muscle also, I think we have forgotten to discuss with it, muscle fatigue. Fatigue simply means that getting tired, we can say, but definition, what is the definition of muscle fatigue? If you are repeatedly stimulating muscle, repeatedly, then what happens? Muscle response decreases. Now muscle is not giving response, and there is loss of activity. Very important thing here is this loss of activity is reversible. Reversible means if you take rest, you are getting your activity back. This is reversible. Am I clear? So definition, exact definition, I'll tell you what is muscle fatigue. Repeated stimuli. Repeated, you can also write down simultaneously. Repeated stimuli reduce responsiveness. Okay, and it produce state of reversible. If I am taking rest or you are taking rest, then your fatigue disappears. If we are tired, we are taking rest, then we can perform our activity. Reversible, loss of activity. Okay, very important definition. So many times it may be asked in your theory as well as practical. I repeat, if you are stimulating the muscle with repeated stimuli, muscle responsiveness decreases and it produces state of reversible loss of activity, and this is known as fatigue. Okay, now very important thing here, how we can demonstrate fatigue. In the nerve muscle preparation, we have prepared nerve and muscle preparation. This is your gastrocnemius muscle and sciatic nerve. Okay, nerve and muscle. Okay, fine. Now here we are stimulating this nerve repeatedly. Suppose you can see first stimulus, then second, then third, 10th, 20. You can see here. So, and you just record the graph. You can see here simple muscle curve. All of you are knowing. How is it recorded? It is recorded like this. You can see here, like this. Contraction, relaxation. Okay. So you can see here. Initially, in initial few contractions, you can see there is beneficial effect. Beneficial effect means because calcium ions are more, temperature increases, H plus ion increases, then there is what happens, height increases, height of contraction. Okay, but if you continuously stimulating that, what happens? You can see this is 10th contraction now. Now height decrease and force of contraction also decreases. You can see latent period increases, contraction period, relaxation period, all are increased. Now, what happens? Gradually, your relaxation becomes incomplete. You can see here, this one, 70th contraction. So what happens? Contraction period is so long that muscle is not getting time to relax. Am I clear? Because gradually your contraction period increases. And ultimately in the last contraction, the muscle remains in a state of sustained contraction. And that is known as contracture or fatigue. Okay, contracture or fatigue. Okay, am I clear? Now, so this is the curve, fatigue curve, how your fatigue develops. This is found by this curve. Okay, now here if you want to find out that where the fatigue has developed, so what you have to do is, you can see here, this is your preparation nerve and muscle and all. So we want to find out that whether the fatigue is developed, whether your fatigue has developed at your nerve, or muscle or neuromuscular junction. So for that, what you have to do is you have to change this nerve, or you have to stimulate the nerve which is supplying to other muscle, and you stimulate the nerve again. You will get curve. So you can say that nerve is not fatigued. Nerve is okay. Second is muscle. For that you have to do, you have to stimulate the muscle directly. Again, you get the contraction. So you can say that muscle is also not the seat of fatigue. Now what happens? You can say that, but this nerve and this muscle, when we are stimulating simultaneously, we have fatigue. So you can say that this neuromuscular junction is the site where fatigue has developed. Okay. So you can see here, where is the site of fatigue? When we are talking about nerve muscle preparation, this is your muscle and this is your nerve. The site of fatigue is neuromuscular junction. Okay. Then later on in muscle also fatigue develops. And if we are talking about intact body, fatigue has developed in the synapses of CNS. Synapses of CNS, central nervous system. We have a fatigue which is developed here. Okay. Now, what is the cause of fatigue? Why there is fatigue developed? You can see here, this muscle neuromuscular junction is just asking for acetylcholine. So what is the cause? When acetylcholine decreases at the neuromuscular junction. And we also have discuss the structure of neuromuscular junction. You can see here, muscle and nerve and all. And we have this vesicles having acetylcholine. So when this acetylcholine is exhausted, used up, then there is genesis of fatigue. And when ATP is also broken down, exhaustion of ATP, then also there is fatigue. So if we take rest, what happens? New acetylcholine is generated. Okay. As well as when oxygen is lacking, glucose is lacking, then also there is genesis of fatigue. So all these factors are removed when we are taking rest. So this fatigue, you can say it is reversible. Okay, it is always reversible. Am I clear? Now, next is, now, which factors they affect fatigue? They are, you can see here, different mechanisms for fatigue. One, that is intensity and duration of exercise. Suppose, if you are doing exercise which is very severe, then fatigue develops very fast. Okay. Duration also has the effect. If exercise is not severe but you are performing for a long period of time, then also you have a genesis of fatigue. Okay. Now, so that is first factor. Intensity and duration of exercise, this one. Second, your type of muscle fiber. As we all know, two types of muscle fibers, fast or glycolytic, and slow or oxidative. Okay. So what is this? Slow fibers, fatigue develops late, whereas in fast fibers, fatigues develop early. Okay, so type of muscle fibers. Then third is effect of exercise. Okay, what is the effect of exercise? If we are performing short duration but high intensity exercise like weightlifting, short distance running and all, so this produces anaerobic glycolysis. So if the exercise is anaerobic, then fatigue develops fast. And if the exercise is aerobic, low intensity, long duration exercise, then because in aerobic exercise, you can see aerobic glycolysis produces 34 ATPs, where here only 2 ATPs are produced in anaerobic. So depletion of ATPs are more in anaerobic glycolysis. Okay. Next is psychological factors. What is the role of psychological factor? If the person is motivated for the action, then fatigue develops late. Mental state of the athlete, here it is seen. If somebody gets fatigued and you motivate the person, this is the reason for boosting up, है ना? Athletes को boost करते हैं ना, cheer करते हैं. That is to improve the this delay the fatigue and improve the psychological factors. Okay. Also, nutritional status of the muscle is also an important factor. If the muscle is not well nourished, then lack of glycogen is there, lack of lipid granules are there. So that also results in early fatigue development. So these are all the factors, they affect the genesis of fatigue. Okay. Now, next is we will discuss some questions, answers we will discuss answers of all these questions we will discuss in our special class. So at present you can write down all the questions if you wish to write down. I'll just dictate you answers we will discuss on Saturday, Sunday in our special class. Okay. Now, there is also one more announcement that now onward special class they become interactive. Okay, so you can talk to your educators in the special class. Two-way communication is possible. So I think they become more interesting for you people also. It is not like that I am speaking and you just can text only. You can speak also. Okay, so that is the one of the other feature we have added. Okay, so now write down the questions. What is muscle tone? How is it maintained? Second, what is hypertonia and hypotonia? Third, name the factors affecting gradation of muscle contraction in intact body. Question 4. What is multiple motor unit summation? When multiple motor units are recruited, their effect is added. Question 5. Write down the effect of initial length of muscle on muscle contraction. Question 6. How warm-up helps performance of athlete? Question 7. What is muscle fatigue? One of the important question for your Viva. Question 8. Write down mechanism of development of fatigue in isolated nerve muscle preparation. Question 9. Where is the seat of fatigue? Question 10. Write down causes of fatigue. Question 11. Write down the factors affecting genesis of fatigue. Genesis means origin, fatigue develops. Factors we have discussed, psychological factors, muscle, you can say that muscle nutrition. Okay, we have enumerated all the factors. Intensity of exercise, type of muscle fibers, effect of exercise, psychological factors and all. Okay, so this is about today's topic. Okay, if you have any doubt, panel is open. Okay, if you like my video, you can like it, share with your friends and subscribe our channel on Unacademy Future Doctors. But please watch the videos and prepare the topic regularly. That I always ask to all the students. Please watch the video regularly. We are uploading regular videos and this will help you to complete your syllabus. So please be regular in watching the video. Okay, thank you.